Hi, I am Dr. Sidharth Verma. I am an interventional pain physician, and in this video I will tell you about osteoarthritis, which is a very common problem and we see many patients who are suffering from osteoarthritis. So, first of all, what is osteoarthritis? Osteoarthritis is a degenerative condition of the knee joints wherein the normal constituents of the joints, that is the bone, the cartilage, the muscles, they all get damaged, not due to any external agents like viruses or bacteria or things like that, but due to unknown and internal factors which may range from age to wear and tear. There is increased wear and tear, and this results in the malfunction of this joint. So, this joint may be any joint in the body. However, it is more commonly seen in the joints which are involved in weight bearing as well as excessive movements. So, these joints may be the knee joint, which is the most common because it bears most of the weight of the body, the ankle joints, the hip joints, even the finger joints, even however, it is less commonly seen in the fingers and hands, the temporomandibular joints, that is the osteoarthritis of the jaw, and likewise. So, this video I will concentrate more on knee osteoarthritis because it is one of the most common complaint for which the patients or people come to me, and if they know certain things, then I am sure they will benefit from it. So, first is what is knee osteoarthritis. As I already told you, if you see, I will zoom on this knee joint now to show you that what is this knee joint. It is a joint which is formed by two bones majorly, that is this upper bone of the thigh, the lower bone of the leg. This is known as femur bone, this is known as tibia bone. There is one more bone which gets involved in the joint, and this is this bone which is known as patella, or in local language we call it as katori of this knee joint, and it is a very big joint, and it is it has a movement only on one axis, and it is very essential for walking, for climbing. So, and it bears a lot of body weight, almost all the body weight above the level of knee is borne by this joint. This is otherwise a very strong and stable joint, and this portion is depicting the quadriceps tendon, and this is a very strong tendon, and the function of this muscle over here is to flex the knee joint and facilitate this motion. Okay. So, it is surrounded by ligaments, as I told you. So, there are ligaments on this side, and also ligaments inside the joint. So, there are ligaments inside the joint also. So, what happens in osteoarthritis is that there is a degeneration of these components of which form this joint. So, degeneration may be in form of bony changes, that is changes in bone, weakness of muscles, weakness of the cartilage, and this results in faulty functioning of this joint, which is presented as pain. So, by the time pain usually occurs, the osteoarthritis process is already on stage 2, and it is important to diagnose this condition before irreversible damage has been done. So, how to diagnose this? It is very easy to diagnose, and around 90% diagnosis can be made by the patient himself. Usually it will start with a small or slight pain in the knee joint, and it may be ignored by the individual thinking that it is a common thing which has happened. However, it should not be ignored because it can be the early symptom of osteoarthritis. You will be surprised to know that by the time the patients come to me, most of them are in the stage 3 or 4 of osteoarthritis. Osteoarthritis, if we see it, the knee joint X-ray, so we can grade it in 4 stages, and as in other diseases like cancer, the third and the fourth stages are the most advanced ones. So, in this also, if the advanced stages are there, then the patient is less likely to benefit from treatment, and it may even be irreversible. So, it is very important that you should or an individual should not ignore the early signs and symptoms, which may be pain, slight stiffness which stays for a very short period of time and then goes away, clicking or crackling noises, These may also be normal. However, if you are finding it on a routine basis, then you must consult a pain physician who can help you on that and diagnosing it properly, because if you diagnose it, or if you are able to diagnose it early, then the chances of increased progression are very less, and you are likely to have your or preserve your joint for a longer period of time. So, now what is this knee joint? I have already told you this, how to diagnose osteoarthritis I have already told you. So, what actually happens in osteoarthritis? So, there are many theories which have been put forward, that what is it that sets this degeneration into motion. The exact cause is not known. However, it is been found and postulated that it may be due to excessive wear and tear, the weakness or misuse or disuse or atrophy of the muscles, nutritional deficiencies, and excessive body weight, which again puts the joint in more wear and tear and results in these changes. So, what is this the benefits of early treatment? If you start the treatment early, then the clear cut benefit is that at least you will be able to arrest the progression of this disease and that particular stage, especially if you come early to your pain physician. So, how we can arrest it, I will tell you in the treatment part, but it is very important for you to know that you should diagnose it early, and then so that the degenerative process can be arrested. In some cases it may be precipitated by injury, because injury can lead to changes which can destabilize the joint and produce permanent changes, and this may increase the process of degeneration and osteoarthritis. So, by the itis suffix, we mean that it is an inflammation. So, if there is any tissue damage in the body, let it be degenerative damage, the body responds by inflammation. So, what is inflammation is that all the cells of the body which usually fight infections, they are rushed to this portion thinking that there is some need of these cells there, and these cells they reach this joint and then they cause inflammatory changes, and these occur in form of the mediators are released, and this cause nerve endings to be activated, and this results in pain. So, what a patient will perceive is either swelling or pain or crackling noises or loss of function, which when detected by the doctor, or which when the patient thinks that it is severe enough to warrant the attention of the doctor, it may be too late. So, I will again emphasize, if you are having any problem in your knee joint, please get it properly examined and then treated. So, I will also tell you about the factors which are predisposing to this development of the osteoarthritis. So, how to prevent osteoarthritis, or how to prevent it from occurring. So, if you are very young and you are very concerned seeing your elder or seeing your family member or seeing your relative or somebody who is suffering from osteoarthritis and you want to avoid this disease, so here are some tips for you. Number one is to stay active. It has been seen that people who are active, who exercise regularly, by exercising I do not mean that you have to go to the gym and put on a lot of weights. For knee or for these joints, the exercise is just free weight movement or body weight movements around the axis of the joint. Say for example, for your temporomandibular joint, the exercise is chewing. For your knee joint, the exercise is walking or swimming, maybe slight jogging, but certainly not on a hard surface and certainly not for prolonged period of times. So, if you use it well, then you are more likely to have the condition or the osteoarthritis delayed. Okay. So, you are less likely to have the disease. So, now what happens is the second factor which is very important is your body weight. For knee joint I am talking especially in relation to the knee joint, because the more your body weight is, the more wear and tear happens at the knee joint, and the more you are likely to have osteoarthritis. Third and very important is your nutritional level. Bone matrix or the bone, it is been seen that there are certain nutrients which are very much necessary and involved in the formation of this bone, and if they are not in proper amount, then you will have an early onset of osteoarthritis. So, these nutrients may be vitamins like vitamin C, collagen, that is a kind of protein, and other vitamins like vitamin D, which is involved in the bone matrix formation, calcium. However, if you see calcium, so many people start taking calcium pills. It is not required. Calcium is usually there in your diet if you are having a good diet which is consisting of appropriate greens, some dairy products, and some nuts, normal Indian diet, it is adequate in calcium. However, the absorption is dependent on this vitamin D, which nowadays we people do not have enough, because many of us are vegetarians, and we do not get exposed to the sun for a prolonged period of time. So, you can supplement it externally, vitamin D, and vitamin C, it is involved in the laying of this collagen matrix and maturation. So, you will get it in fresh fruits, citrus fruits. So, try to eat fresh and try to avoid the junks which lead to build up of your body weight. So, in addition, I think if you are exercising regularly, keeping your weight in check, avoiding all the nutritional deficiencies, then you are less likely or not likely to have osteoarthritis early in your life. Now, so how does osteoarthritis progress? It progresses in stages, and it has a very peculiar waxing and waning course. Means that at one point of time you will have lot of symptoms and lot of pain, but then you will take some painkiller or something, or even if you do not take these drugs, still this pain will subside, and you will have relief from the symptoms, and you will think, okay, now my knees are okay. But very sorry, this is not the case. The disease is going on. It is just that your body has adjusted to that level of pain, and now it is adapted, and it all has been done already. So, after some time again the symptoms will start, and you will, or the patient will start having pain again, and this waxing and waning course like a wave. At some time the symptoms will be high, sometimes they will be low, will continue till the point of no return. That is, till the point it has been damaged, your knee joint has been damaged so badly that it is functionally not able to serve the purpose, which is walking or climbing stairs or movement. So, movement is hindered, and once this movement is hindered, then it is a vicious cycle. So, low movements or no movements, then again weight increase, then again low movements, then again weight increase. So, it will lead to a cycle from where it is virtually a point of no return. So, it is very important that once you have pain in your knee joint, swelling or any symptoms, and somebody tells you that you have osteoarthritis, or you have a concern that okay, I am having osteoarthritis, please do not waste a single day. Just come to your pain physician and get yourself diagnosed properly and then treat it properly. So, now what is the treatment for this? Depends on what stage you come in. So, treatment options are varied and variable. So, if a patient or a person comes to me with stage 1 osteoarthritis, that is, it is very early stages, then probably I will like to give him a few supplements and first try to find out whether there is any deficiencies. If there are, then I like to correct them. I usually avoid painkillers. The reason being that with painkillers you are suppressing the body's ability to sense pain and nothing else. So it will not tell me whether my treatment has helped actually or not. And number 2 is that once you pop in a painkiller, you feel okay, I am all cured, and then you may be very lax, which may be bad for you or the patient in the long run. And long run is not like maybe ages together, it is maybe around maybe 2 years, 3 years or 4 years. You are more likely to see accelerated changes if you are not very careful. So, treatment in stage 1, first correct the nutritional deficiencies. Second, give the supplements. There are some supplements which have level 1 and 2 evidence for being beneficial in osteoarthritis, and some of them include some collagen peptides and glucosamine. Glucosamine may be the recent evidence has degraded. However, there is good evidence for collagen peptides in combination with vitamin C. So, what this collagen peptide does is it gives the body a chance or increased chance to help and repair the damaged portions of the cartilage, and hence it reduces the pain. So, these are the options if you come in early stages. if this doesn't help, then there are certain products which are available. Human synovial fluid, synovial means the joint and fluid means there is a lubricating fluid which is present inside the knee joint. So you must have often heard people telling, अरे तुम्हारा घुटनों का तेल खत्म हो गया, or maybe your knee oil has finished now with age. So it is partially true also, because there is a fluid or a liquid which is present normally, which is known as synovial fluid. It is secreted by the membrane or the cells in the membrane of the synovium, that is the joint. So what it actually does is it has multiple functions, because there is no blood inside this joint. So it provides nutrition, it provides lubrication, it provides support and framework to the joint. So in patients with grade 1 osteoarthritis, it has been seen that if you put in proteoglycans, that is or the diclosaminoglycans, that is, it is a kind of molecule which is synthesized now by pharmacological laboratories, and it is available in injection form. So if you put this inside the joint, then the patient is likely to benefit from this injection, because it helps in lubricating and it helps in the cartilage sliding, gliding movements, as well as it has been seen that up to 1 year it is effective, because it is very high molecular weight, and this certainly means that it cannot be disposed of because there is no blood supply. So it stays there and it helps to arrest or to ease the movements of this joint. Okay, so what actually happens in stage 1 is that all your efforts are towards preventing the joint from degrading into stage 2, or preventing the changes of osteoarthritis from progression. So if the patient now comes to you, or maybe you have tried everything but still the patient progressed into stage 2, then at stage 2 the treatment level further increases, and there are some other products which are tried. There is something known as prolotherapy and regeneration therapy. So prolotherapy means that you actually stimulate inflammation artificially in that area, and you want the cells to come there so that the body can heal itself. So we use various substances like hypertonic saline, like hypertonic dextrose solution, so like platelet-rich plasma. So what actually happens is, by giving this, you are stimulating the healing, and hence stage 2 and early stage 3 can benefit from this procedure. Platelet-rich plasma, the results are variable, and they are variable because of the method of preparation of this platelet-rich plasma. So your doctor must ensure that the platelet-rich plasma, which is, he is taking your blood and extracting rich plasma out of it and putting it in your knee joint, so it must be of high quality and it must be tested so that it is of most benefit to you. Another treatment which is in vogue in these days is stem cell therapy. With platelet-rich plasma, there is unequivocal evidence. Some studies say that it is able to help, some studies say that it is not able to help. The reason for this is probably the method of preparation. However, in stem cells, the literature is very clear that till date it is not very helpful for this knee joint, and there is very low quality evidence in favor of injecting stem cells. So currently we are not doing this stem cell injections in the knee joint. However, with when the evidence is growing, we are currently conducting various studies, and probably in future I see a good use of stem cells in the stage 3 or maybe even in stage 4 cases of osteoarthritis. Now, if the patient has further progressed to stage 3 or 4, or if you have advanced stage osteoarthritis, then what are the treatments? I will like to stress on here that whatever treatments I have told you, they work only when combined with other modes of therapy. So a multi-modular or multidisciplinary treatment is very necessary for all this treatment to work. By multimodal or multidisciplinary, I mean that you have to combine these treatments with other things like active exercise, like swimming, like walking, like correction of the nutritional deficiencies. So unless you correct all this, you are less likely to achieve good results. These things become more important in stage 3 and 4. So first thing, when a patient comes to us in stage 3 and 4, we see is whether there is actually a deformity. Deformity means that if one-sided cartilage is completely destroyed, then what happens is that there is a bend in the knee, which is usually not seen in adults. Like there is a bend like this. So the knee joint, which is actually straight, will become slanted or tilted. So when patient will walk on that tilted joint, then obviously he will be having more and more pain, because it is unphysiological. So what do we do in these patients is that we first assess them whether they are having any deformity. If there is a deformity, then we first correct the deformity with the means of an offloading brace. That is, we put a brace and help the patient to slowly correct this deformity. If it is not corrected, or it is not amenable to correction, then we will refer it to a surgeon, who will then think of doing it via an operation or an surgery. Now, if the deformity is not there and the patient still has the last stage or the third stage of osteoarthritis, then what we can do is we can still help these patients, because these patients are in a totally different set of problem. The problem is that because of increased weight or maybe because of advanced disease, now they are having this osteoarthritis and they are having a lot of pain. And whenever they go to a doctor, the doctor tells them that do more exercise or do more physiotherapy, which they cannot do because they are in lot of pain and it is not being helped even with painkillers. So what we do here is we block the nerves, and what we do is we actually go to the nerve supply of this knee joint, which is at various places around it, and we actually give a radio frequency current there, which helps in desensitizing these nerves, and the patient starts having relief from this pain. So once this happens, patient is able to resume the activity, because this procedure we do a neuroplasty, which does not involve any cutting. It is just a current. So the nerves are deactivated only for some time, maybe 6 months, and then they regrow. So, but however, for the patient this means a lot, because if at this time he is able to walk or do these exercises or take the help of other therapists, modify his occupation, then often we have seen that a great number of patients will be benefited from this procedure, and they will be able to reverse the effects which osteoarthritis has had on their life. If this doesn't also work, we may consider combining it with prolotherapy. We usually use it in combination. If this doesn't also work, then we may refer the patient to a surgeon for knee replacement. However, the story doesn't end here, because even after knee replacement, every 2 to 3 patients out of 10 patients will have post-operative pain, which is a different entity in itself and which also needs to be treated. So if you think that knee replacement is the holy grail, and once I replace my knees and I'll be able to jump and fly, so it's never going to be so, and a very thoughtful decision should be taken for replacement of this knee joint. So if you have any more questions, you can visit my website, my clinic website, on www.painreliefcenter.in, painreliefcenter.in, or you can visit on my Lybrate website and ask your questions or queries there. The address is www.lybrate.com/doctor/Sidharth Verma, SIDHARTH VERMA. Thank you for watching. Wish you a healthy life.